Over time, I realized that like my heritage is my superpower. And that honestly like changed everything. And because there's a lack of representation and because people don't know, many Latinos haven't had access to like expert in-depth nutrition guidance. And a lot are relying on what their tia or their prima did to lose the weight. There's a lot of misinformation. Personalize everything because there is no one size solution.
Hola, amiga, and welcome to the Latina Leadership Podcast, the podcast by Latinas for all women. So get ready because today's conversation is really special. Welcome back to the Latina Leadership Podcast. I'm Gracie, your co-host, and today I'm here with Mariana Dineen. Mariana, we ask all of our guests to introduce themselves and what they do. So who are you and what do you do?
Yeah, so my name is Mariana Dineen, like Gracie was saying. I am a Latina registered dietitian and I am a mom of 3. And what do? I am a dietitian and I provide nutrition care specifically for the Hispanic and the Latino communities. I am based out of Chicago, but I'm 100% virtual. We are 100% virtual. So we see patients all over the country. So yeah, that's a little bit about me. Born and raised in Mexico. I lived in New York for a long time. Then I moved to Houston for 2 years. And now I've been in Chicago for 5 years.
And I would love to hear about your journey to earning your bachelor's degree in nutrition and what led you to do that career path.
Right. So I think it's a little bit, it had to do a little bit with cultural expectations. Let me explain that. So I grew up in Monterrey, Mexico, in a very conservative environment. And I wanted to be a doctor. But I basically got kind of told, but if you become a doctor, this is like many years ago. If you become a doctor, you're not going, how are you going to meet a husband? And like, how are you going to like have a family? And like women should be in the house taking care of the kids and like taking care of like cooking meals and stuff like that. So I was kind of discouraged a little bit about that. And it was actually my mom who introduced nutrition to me. Like she brought a brochure and I was like, this sounds cool. Like I'll be in healthcare, kind of. And I get to have flexibility. Like I can have my own private practice. So I like the idea and I honestly don't regret it at all. It was a choice that changed everything. So I did my undergraduate in Mexico. And my turning point was when I moved to New York City in 2007 to do an internship at Lenox Hill Hospital. And that kind of really solidified my passion for nutrition. Like I wanted more. So like I got it in my head that I was going to move back to New York because I only did it for the summer to get my master's in clinical nutrition. And it was going to be New York or nothing. So I only applied to NYU. And that was maybe not the best strategy, but like I was a one-track mind. I was determined. So yeah, I moved to New York in 2009 to get my master's in clinical nutrition and do my internship. And I worked in clinical, in outpatient, in corporate nutrition. I did all of the settings. But I kind of realized that I wanted to create something of my own. And I don't want to say that I had like challenges as a Latina, but Elemento Health was born from the desire to bridge the gap between nutrition and like cultural identity. So yeah, that's how I got into nutrition. I had no idea that this is what I wanted to do. I wanted to be a doctor, but yeah.
And throughout your journey of getting your education and starting your career, were there any mentors or role models that helped you and gave you advice?
I mean, yes and no. I would say definitely role models, but, and I wouldn't say that it was a challenge, but there was definitely a lack of representation. Like I remember this role model, I actually never met her, but like a very famous dietitian living in New York. But it was like something extremely unattainable for everyone because she would charge $1,000 per session. She wouldn't take insurance. You needed to commit to 10 sessions with her. So like right then and there, like $10,000. So there wasn't any representation. Like there was a lot of lack of representation in the field. So like it kind of made me question if I truly belonged. And then the other thing was like nutrition is often westernized and there's very little acknowledgement of the diversity of cultures. So, I mean, all my teachers were amazing and they all were great mentors. So, yeah, I guess kind of.
And how did your journey lead you to starting Elemento Health? Like, what really inspired you to create this?
I think we are in the middle of a health equity revolution. And there's so much attention placed on health disparities that have existed in healthcare, especially with the Latino community. And I just saw way too many barriers. Way too many barriers. The reality is that like language and cultural values prevent Latinos to getting access to quality care. And even if there's a provider that might be able to speak Spanish, they often lack the true cultural relevance, leading to like generic advice. And I would say that while I was like during graduate school, at first I felt that I had to like assimilate to be taken seriously. Like I thought that being successful as a dietitian meant breaking into the white world of nutrition and kind of distancing from my culture. Not really distancing because like I'm very proud of who I am. But and by the way, I married not a Latino, a white guy. And he would always like tell me to focus on my community, to like focus on like Spanish speaking, and instead of like trying to chase something. Like I said, I felt I had to break into that world to be considered successful. But over time I realized that like my heritage is my superpower, and that honestly like changed everything. I remember being at a conference in University of Chicago, and they brought like real patients to the podium to talk about their experiences navigating the healthcare world as Latinos. And it was very eye-opening. Like I had tears in my eyes because that really solidified, like what they were saying really solidified my decision to start Elemento Health. How they didn't feel seen, how they didn't feel understood, how the doctor like didn't speak the language and didn't like, I don't know, there's a warmth when it comes to Latinos that I feel sometimes like it could be hard when your provider is not, I don't know, there's not a connection. So yeah, I feel that I just feel that there was a big gap and I wanted to bridge those barriers. So that's why Elemento was born. We are 100% bilingual, so we offer nutrition services in English and Spanish and Spanglish. English is not my first language. I grew up in Mexico, so like Spanish is my first language. And also like I feel that Latinos have been overlooked in healthcare, and the consequences are they're real. Like we have higher rates of diabetes, of heart disease, of obesity. And I feel that there's a mistrust in the healthcare system. And right now, like, I don't know, yeah, there's a growing awareness for the need for culturally competent providers who really understand the communities they serve. So I feel very empowered when I was like, okay, I need to do this. Like, I need to be there for them. I want to be the nutrition go-to for Latinos.
Yeah, I've actually seen a dietitian and that they didn't really understand, the traditional foods that we ate and how it's just how we eat things. Like I eat whatever my grandma made or whatever my mom made. And she changed my meal plan like to where I wouldn't even be able to eat those foods anymore, and it just didn't make sense to me.
And you know what? It's not only like food, culture, traditions, family. I feel like it's a big part, but it's not only about that. I remember it's just like, I don't know how to explain it, who we are. I remember when I moved to New York. So I was what, 22? Like I left home. I was living with my parents in Mexico. And I was meeting my roommates um for the first time, and it was time to say goodbye. So I was like, okay, bye. And I leaned in, and they literally, like, one of them literally, like, put their arm out. And I felt so ashamed and I felt so bad. Like, I never wanted to see her again. And it was just a cultural thing. I mean, she became best friends and like we're still very close, but that's like, it's not only about the food and our traditions, it's also like that, I don't know, warmth. We're warmer people. Um, but yeah, that's sad that our foods are sometimes demonized. Um, there might have to be a change in portion sizes or balance if you are trying to reach a goal, whether it be like control your sugar levels or like lower your cholesterol. But the thought that like all of our foods are bad and not healthy and all our diet, um, that's sad.
Yeah, I know for my family, we have like diabetes run in our family, high blood pressure. I guess how do you go about doing meal plans for other people who may have those health problems?
Yeah, so it is very, very, very personalized. I really take the time to listen to the patient and meet them where they are at. I really try to understand who they are, their lifestyles, their budgets, what they like, what they don't like. And then we start making small changes. Um, like I always tell them that I want this to be a forever, not a 3-month thing. So we start building small habits. We start changing small things. And it's usually um, the lowest hanging apple. A lot of people come to me thinking that I'm going to give them, we do provide a lot of meal ideas and recipe ideas and things like that. But usually never we will be like, here's your meal plan and you are going to eat exactly what this says. Like when I went to a dietitian in Mexico, that's how it worked. Like they gave me a meal plan. I followed it to the T. I would go to the dietitian the next week, get on the scale. But that's not really how it works because I want them to really understand how to fuel themselves, how to balance things out. Like understand, have the foundations of nutrition so that you can build plates that are balanced, that are calorically appropriate to you, that are nutrient dense. And then also learn all the skills that you're going to need to maintain those habits. So it's very personalized. It's very different for everyone. So like, I don't know, if someone tells me that they start their morning with like pan dulce and like café con leche, like I wouldn't jump in and be like, cut that out. Like I'm not the food police. Like you need to switch to oatmeal right away. Like what does that mean to you? Like, do you have time to cook in the morning? Is it something that brings you comfort? Like, and by understanding the why behind their choices and also providing nutrition education and never providing nutrition education in the way of like me lecturing them. Uh, but with those two combined, you can guide them towards solutions that work better or best for their reality. But it's different. It's very different to everyone. But I would say the key is to meet them where they are. And super important to consider like their lifestyle realities. Like if someone is skipping breakfast, just maybe yes, maybe no. It's because maybe they're not bad at meal planning, but maybe they have I don't know, a long commute or a demanding job or like a lot of responsibilities at home. So instead of forcing a rigid meal plan, like you need to have breakfast and you need to eat this for breakfast, I work with their routines and find realistic options. Maybe for that person, it's a realistic grab and go that fits their needs. But again, meet them where they are at Um, there's a lot of nutrition education provided because I really want them to understand how things get digested and how they work. The more knowledge, the more power. But it should be something empowering, not overwhelming. Unfortunately, and I feel many people don't know that nutrition services are covered by insurance. I would say that 98% of my patients pay $0 out of pocket. And because there's a lack of representation and because people don't know, many Latinos haven't had access to like expert in-depth nutrition guidance. And a lot are relying on what their tia or their prima did to lose the weight. There's a lot of misinformation, but I would say listen, 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 and personalize everything because there's no one size solution.
If you're all about education, going back to school, or you're currently navigating college right now, we have something very exciting to share. Our Latinas in Education is coming very soon. So be sure to follow us at Latina Leadership Podcast on our socials because we'll be updating and you can reserve your spot at our event. And because you work to like personalize this meal plan for them and you make it specific to them and who they are, what has been like the biggest impact you've seen since starting Elemento Health? Like where you're like, this is actually working?
I mean, obviously seeing like cholesterol levels drop by like 60%, like people losing weight, people feeling better, being like having more energized, but also just the like sometimes it's like, oh my God, thank you so much. Like my husband is now like listens to me to what I talk about and he's all, like now following your advice. Just those messages of like gratitude from people like thanking us. And sometimes even the email when they're reaching out and they're like, I am looking for a Spanish speaking Latino provider that understands my culture. Like that to me is music to my ears. Like that brings me so much joy. But yeah, I mean it's seeing those patients reach their goals and everyone has different goals. So for some it's losing weight, for some it's lowering their cholesterol levels, for some it's healing their relationship with food. So it's like helping them feel empowered also, I would say.
And since you work with Latino communities, what are some of the biggest disparities that you see when you work with them?
I would say language, accessibility. That's why we are 100% virtual. Cost. So that's why we accept insurance. And for those of them who don't have insurance or can't go through insurance because they have very high deductibles or something like that, we have very affordable memberships. But I would say those are the two biggest: language, cost, and accessibility. So again, virtual, like from the comfort of their home, like from their office. Cost, like let's go through insurance. 98% people pay $0 out of pocket. Some people pay like $40, which is like, I don't know. I feel that a lot of people don't know that nutrition is a service that is covered through insurance. They feel that it's usually like an out of pocket service. Many dietitians are out of pocket, unfortunately, and like you could be paying thousands of dollars. And language. And even if it's not language, because I see a lot of Latinos that live here, that they were born here, right? But it's just that cultural connection can also be a barrier. Unfortunately, I think there's only, I don't remember if 10 or 12% of dietitians are Latinas, I think, last I checked. So yeah.
And going back to accessibility, I know for my family, we work really late. We get home late because of driving and the distance. Sometimes we don't have time to make dinner, things like that. I guess, how do you go about, you know, these strategies to help them with this? Because I know we pick up food way too often.
And there's nothing wrong with that. Like I have a lot of clients that are like busy, patients that are busy and they're like have to take clients out to work or that are entertaining or that have parties, you know? So maybe it is like balancing more your plate. Remember that you're not trying to overhaul your entire diet. It's working with small steps. So if you would say that that is the biggest challenge, okay, so how can we make this takeout a little bit healthier? What can we change? How can we balance it out? And it's just confidence and the resilience of like, okay, I was successful. I can do this. It's not that hard. Like, I can do this, you know? Or it's maybe like I'm a very lazy cook. I like to cook, but I'm very lazy. I'm a mom of 3. I'm busy. So I prep very easy, very quick meals. I use a lot of um like proteins that are already cooked and already made. I cheat a little bit and I use like pre-cooked rice that is frozen and that I put in the microwave for 3 minutes and it's done. Um, a lot of people could never do that because like, oh my God, rice or like frijoles de olla from scratch, you know? But it's like, it's understanding where you can make those sacrifices or you can make those changes. But I would say easy meals that take 20 minutes or less to make. Or it's maybe like, okay, if right now you are not willing to, or you don't have the time to cook, okay, how can we improve your takeout options? And then it's working from there. It's like one tiny step in front of the other. Unfortunately slash fortunately, real nutrition, like sustainable nutrition, is not sexy, is not novelty. It's going back to the basics. But yeah, it's not going to be the diet or the pill or the tea or the greens powder that you're drinking. Those are the easy things. And then like the work that you have to put in or the sacrifices or the changes. Yeah, sometimes they can be hard because you're trying to change habits. Um, but it just depends on like what we're working with, what we're trying to do, where they are at right now.
No, I love that because for me, it is my schedule that gets in the way of cooking every day and staying healthy and going out grocery shopping.
You have a job, your schedule's not going to change. So again, it would be very personalized. We would have to like, it has to work for you and for your lifestyle and for your schedule. Sorry. And for your budget. So it would be unrealistic if I told you that you need to cook everything from scratch and you can't be taking outside. You know, we would have to, what's the next best step for you? And then from that, you build.
And do you ever have patients who maybe feel unmotivated or feel like there's no fixing their diet, who think maybe it'll be hard for them to do it?
Yeah, I do, unfortunately. But it's just kind of digging deep and seeing where that resistance is coming from. And then sometimes like it starts with nutrition, but it's not always about nutrition. So like sometimes we're not talking about nutrition. Sometimes we're not talking about food. Sometimes we're talking about the stress that they're having or the fear of change or like why the resistance. So it's going slow. It's listening and understanding and then addressing those things because a lot of things influence our food choices and our behaviors. So, but yeah, there's people that start super motivated and then like, oh, well, I couldn't do that and I couldn't do this and I couldn't do that. So maybe it's like taking a couple of steps back. Maybe like I usually say 1 to 3 goals. Like during our sessions, we'll identify 1 to 3 goals. We'll make a plan and then we'll follow up what worked, what didn't work, what were your obstacles, and then how can we troubleshoot for that? How can we find solutions? And that's how slowly you build. I feel like it's a very transformative journey. You learn a lot about yourself. You're analyzing, you're creating awareness. So maybe it's taking a step back. Maybe those goals were too big and she wasn't ready for that. So like maybe we cut it in half or we change the goals, and there's nothing wrong about that. Like every step is a step in the right direction. Um, it's a learning. Like maybe, you know what, that's not the way. That strategy doesn't work for that client. And so the client or the patient already knows that. So that's a win in from where I see it.
And for someone who wants to be a patient at Elemento Health, how often are the sessions?
It depends. At first, depends on the goals, but I would say at first, weekly, and then we can spread them bi-weekly or even monthly. It also depends on your insurance. Some insurances have unlimited visits, so we can do it weekly. And if they like it and they like to meet every week, depends on the personality also. But I would say that at first, weekly, so that we can like solidify and they can have that accountability and that support. They get so my patients get unlimited messages through the portal in between our sessions for added accountability and added support. But then some plans only like have 3 visits per year. So we need to space it out. So it depends on a lot. But I would say weekly or bi-weekly.
Well, where can our audience and our listeners find you?
So they can find us on Instagram. Our Instagram handle is Elemento_Health. Or at our website, elementohealth.com, or they can shoot me an email. My email is mariana@elementohealth.com.
Thank you so much for joining me today, Mariana.
Thank you.
Thank you for joining us in this amazing conversation today. And if you need more information or resources, as always, they'll be in the description below. Please don't forget to follow us everywhere at Latina Leadership Podcast to stay updated with our latest releases, events, updates, and more. And with that, we'll see you next time.